My first stroke happened approximately 4 years ago. The second stroke happened a year and a half ago, and I was rushed to Rhode Island Hospital. Over a period of time, I lost the use of my right arm completely. I was unable to walk, and my speech was very bad.
When I first met Harold, I was very impressed by him because it was clear that despite the stroke, he wasn't going to let anything slow him down. He had a very positive attitude and was very eager to try new things to help himself.
Well, the biggest thing I saw was being unable to do minor tasks because I was primarily right-handed. Doing simple things like tying your shoe or just grabbing your pants to pull them up in the morning is very frustrating. My interest in the clinical trial became really heightened because I have a technical background, and it kind of intrigued me to find out more about it.
Deep brain stimulation is a technology that allows us to modulate brain circuits to help improve neurological function in different disease conditions. In this specific clinical trial, we're hoping that deep brain stimulation targeting the motor pathways can help people who've had a stroke recover some of their function, specifically their hand function.
That's the biggest thing I'm hoping for, to have maybe some of that back a little bit, to be a little bit better.
Deep brain stimulation is very much like a pacemaker for the brain. In this case, it's a little battery implanted under the skin of your chest that connects to wires that go into your brain, and we target specific circuits in the brain to try and help with different sorts of neurological problems.
Not only is it an opportunity to give back if it doesn't work for me, but it's a way I can possibly improve myself. So it's a twofold thing.
Harold first underwent placement of a DBS lead into the cerebellum, and then a week later he had his battery implanted in the wall of his chest and connected up under the skin so that everything's fully implanted, nothing's exposed. And that way we could program the battery remotely, and that would control the stimulation that goes through the lead.
Since I had the implant done, I would say I've been feeling pretty decently in the beginning. It was a touch to get used to it, but I don't really notice it, and I've been feeling really good.
Patients have an EEG placed on their head, and the system is tuned over several sessions to try and find the right response in the motor circuit, and that lets us know that the DBS system is set properly so that when they then undergo rehabilitation, the system is stimulating the proper circuit to hopefully get the benefit of recovering more motor function.
It's really quite amazing seeing your hand going from it's not going to move, then all of a sudden your fingers are moving. It's a really exciting process, at least it was for me.
In this trial, we don't think that it's DBS alone that's going to actually help patients recover hand function. Rather, we think it's the combination of deep brain stimulation with rehabilitation therapy that will allow patients to recover hand function, because the role of DBS is to reactivate or reinvigorate the brain's own mechanisms of plasticity, of relearning how to use the hand.
If I were to reflect back and look at what's changed in my day-to-day life, I would have to say that I'm incorporating more of my hand and my arm, trying to get it more active and looking at some different ways I can improve the functionality. I've noticed a lot of functionality coming in things I wasn't able to do. I'm able to not master, but have gotten a lot easier.
We're really excited to be participating in this trial, and we're really honored to be working with our colleagues at the Cleveland Clinic and other top institutions to conduct this study to understand if this could be a potentially revolutionary therapy to help people with stroke recover. And we hope that people like Harold benefit from this and will be able to regain useful function that helps them in their daily lives.
Honestly, I'm amazed. I mean, my hand, I wasn't able to quite pinch some things. I wasn't able to grab some things. I'm able to grab things. I'm able to pick things up. I have more rotation in my wrist. So I've seen a lot of progress in my short time. What they're doing here is phenomenal. So there is a lot of good things to come. Where it's going to end up, I think the limit is the sky. There isn't a limit.